The ultimate guide to soft tissue fillers. Soft tissue fillers, also called dermal fillers, are a popular treatment for men and women of all ages. There are many types of injectable fillers to volumize areas of the patient's face or diminish the appearance of wrinkles, creases, fine lines, or even acne scars. The expert application of fillers can be a more cost-effective alternative to cosmetic surgery, giving patients immediate results with no recovery or downtime. Here's a quick guide. What are soft tissue fillers? Soft tissue fillers are FDA-approved gel-like substances that are injected under the skin to help fill wrinkles or enhance facial volume in key areas. As we age, we naturally lose collagen and adipose tissue or fat. This can cause the formation of wrinkles, fine lines, or facial depressions. Cheeks may come to appear more hollow, and the lower face may start to sag, and lips become thinner and form lines around them. Fillers can be injected to all these areas to plump them and stimulate natural collagen production. Just the simple action of injecting stimulates collagen. Common injection sites for fillers are the cheeks, the lips, the nasolabial folds, which are right here, the marionette lines, these lines here, and around the mouth. What are hyaluronic acid fillers? Hyaluronic acid fillers are the most commonly used types of fillers in the market. Since hyaluronic acid is found naturally throughout the human body, these fillers are very safe and effective, yielding immediate and often dramatic results. Some hyaluronic acid fillers I use in my practice are Juvederms, Restylane, and Revance. What are calcium hydroxyapatite fillers? Radiesse is a calcium hydroxyapatite filler made of calcium and phosphate ions, which are naturally occurring in the human body. Calcium hydroxyapatite fillers are best for especially deep wrinkles and creases in the lower face because the substance mimics connective tissue. It's also used in the cheeks for the same reason. Results show up right away and last for roughly 12 to 18 months. An added benefit of Radiesse is that it stimulates collagen, and so most people find that they need less filler over time and they don't have to have the injections as often. What are collagen stimulating fillers? Collagen stimulating fillers are made up of polyalactic acid, which works deep within the dermis to help facial tissues restore its own structure and firmness. Results appear gradually as the body replenishes its own collagen stores at the injection site. Collagen-stimulating fillers like Sculptra Aesthetic are commonly used to fill in the nasolabial folds or smile lines, marionette lines, or chin wrinkles. I also love it for the cheeks and the temples. Sculptra Aesthetic can last 2 years or more, and results can be maintained with repeat injections after the initial treatment. Generally, patients will need about 3 treatments spaced a couple of months apart to achieve maximum results. How much do soft tissue fillers cost? Soft tissue fillers range widely. A syringe of Juvederm can cost as little as $600, while a syringe of Sculptra Aesthetic can cost as much as $1,100. Plus, there's the cost of the expert who's performing the injections. Price ranges also vary a bit depending on which part of the country you live in. When you call to make an appointment with your doctor, you can ask for a general estimate. You will get a more detailed estimate after your doctor examines you prior to the procedure. It's hard to give exact figures because different patients need different amounts of filler or different types of filler, and each brand name includes different varieties of the product and different applications. Can I get Botox and filler at the same time? Yes, you can absolutely get Botox and filler at the same time, and often it makes sense to do so. Filler is most often used to correct signs of aging on the lower 2/3 of the face, while Botox is used more on the upper third of the face, though it can be used to subtly lift the upper lip or the tip of the nose. The two methods work differently. Botox reduces the appearance of wrinkles by freezing the surrounding facial muscles. Fillers reduce the appearance of wrinkles by plumping them up. For comprehensive facial rejuvenation, Botox can be used alongside soft tissue fillers to address all areas of cosmetic concern. What are the risks of soft tissue fillers? Soft tissue fillers carry very few serious risks because the procedure is minimally invasive and products are made from biocompatible substances. But this is assuming that a qualified healthcare provider is performing the injection. In recent years, the number of facial filler providers has exploded, and you need to do your research to see who has adequate knowledge of facial anatomy and aesthetics. Ideally, fillers should be injected by a facial plastic surgeon in a sterile office setting. I strongly advise against getting fillers injected at a salon or a promotional filler party, as the risk of poor aesthetic results, infection, or even scarring may be higher in these scenarios. Unfortunately, I've fixed numerous botched filler jobs by unskilled professionals, and I always feel for the patient who believed they were in good hands. Fortunately, if the filler was a hyaluronic acid filler like Juvederm or Restylane, a substance called hyaluronidase can be injected to help dissolve it. Some of the most common issues I correct are asymmetry, visible lumps or bumps, and excessive augmentation. Do soft tissue fillers hurt? Most people experience only mild pressure and slight stinging when getting facial fillers. Many products come with some lidocaine to numb the site as the filler goes in. Some practitioners use ice or topical anesthetic to further desensitize the area prior to the injection. If you're especially anxious or your procedure is extensive, a full dental block can be used. If you're needle phobic or concerned about pain, be open and honest with your doctor, as they are likely to be able to make accommodations for you. What is the recovery time after facial fillers? One of the biggest advantages of dermal fillers is that they are quick, easy, and require virtually no recovery time. With most fillers, the results are visible right away and settle in within a day or two, but it can take up to 10 to 14 days to finalize after that initial swelling has gone down. Patients can usually resume normal activity right away, though strenuous physical activity should be avoided just for a day or two in case you may have any bruising. Slight bruising, redness, and swelling are expected at the injection site and should resolve within a week. These can often be hidden with makeup. Applying ice can help minimize these symptoms. Just to be safe, I always advise patients to get filler at least 2 weeks before an important event or photo session. Do I need a soft tissue filler plastic surgeon near me? If you're in the Houston area or interested in traveling for expert soft tissue filler treatment, please reach out to my office to discuss your options. It is not uncommon for my patients to fly in from elsewhere to have me perform their surgery or treatment. Have questions? I'm always happy to hear from you. Email anytime. Thanks for watching.